Mr. President, I also rise to speak about the nomination of Congressman Price as HHS Secretary. I will oppose his nomination, principally because he has been an opponent of virtually every program that provides health care access to people of modest means in this country: Medicare, Medicaid, the S-CHIP program, which he called socialism, Planned Parenthood, which is the primary health care provider of choice for millions of women, and the Affordable Care Act. There's much to talk about, but I'm going to focus my comments today on his repeated promises to repeal the Affordable Care Act. Repeal of the Affordable Care Act would be very unwise, it would be heartless, and it would be economically foolish. The Virginia stats are instructive. In Virginia, 179,000 Virginians have been able to enroll in Medicaid since the ACA was passed, an additional 179,000, and nearly 380,000 Virginians have been able to get coverage through the marketplace. We haven't done the Medicaid expansion program. If we did, another 400,000 could receive care through the ACA. Nearly 4 million Virginians have protection against discrimination on the grounds of pre-existing health conditions. They have such conditions, and they could be turned away from insurance companies, as they have been in the past, as my own family has been. Before the ACA, only those with employer coverage got tax benefits to help pay for health insurance, and now 320,000 moderate and low-income Virginians get tax credits averaging $275 a month to help them. In addition, there are nearly 5 million Virginians with employer-sponsored insurance, and over 800,000 Virginians would lose access to free preventive care under Medicare if the ACA were to be repealed. Nationally, a repeal of the ACA, under an estimate of the Urban Institute, would cause 30 million people to lose their health insurance. That's the combined population of 19 states. We had a hearing last week in the Senate Help Committee about the Affordable Care Act, and it was called by the majority Obamacare emergency. And I asked the witnesses, Democratic, Republican, and of no political identification, I asked them, would a repeal of the Affordable Care Act with no replacement be an emergency? And all the witnesses agreed that it would. And one of the witnesses said it's more than an emergency, it would be a catastrophe. And so then I asked these witnesses, again, bipartisan witnesses, okay, we shouldn't repeal it. That means we should fix it or repair it or reform it or improve it. Should we do a fix or improvement hastily, carelessly, and secretly? Or should we do it openly, publicly, carefully, and deliberately? And they all said, of course, we shouldn't do it. We shouldn't rush. We should get this right. And that's why many colleagues on our side have asked Republicans, sit down with us and let's make improvements, but don't push people off of health insurance. It would also lead to significant economic catastrophe for hospitals, for providers, to have a repeal and not know what comes next. And remember that health care is 1/6 of the American economy. If you inject uncertainty into that, you have consequences that we could not now predict. They would be negative. But the real story isn't any of these statistics, and I'll pick up on what my friend, the senator from Arkansas, said. The real story is about individuals, patients, and what happens. 3 weeks ago, I put on my website a little section, kaine.senate.gov/ACA story, and I asked people to submit what it would mean to have a repeal of the Affordable Care Act. And to date, I have had 1,654 submissions by Virginians of what it would mean to them. And we've been able to follow up on some of them and get permission from some so that I could read their stories on the floor. And so during the remainder of my speech, I'm just going to tell you what a repeal of the ACA would mean to people all over my Commonwealth. Michael Dunkley lives in Alexandria, Virginia. Quote, I was diagnosed with advanced stage 4 non-Hodgkin's lymphoma cancer in October of 2013 and was put immediately on an extremely powerful 5-component chemotherapy treatment program that would conclude in late January 2014. My medical insurance coverage at the time of my diagnosis was under the terms of COBRA, and my monthly premium was $875 with a $7,500 deductible and a $15,000 out-of-pocket limit. My COBRA coverage expired on midnight, December 31, 2013, and was immediately able to be replaced because of a plan I had been issued through the provisions of the Affordable Care Act. Because of the new law, I could not be denied coverage to a pre-existing condition, advanced cancer, and I was issued a new plan that was far superior in coverage and cost me only $575 a month with zero deductible and an $1,850 out-of-pocket limit. 3 days after receiving my new health insurance coverage, I was infused with a 5th round of chemotherapy, for which I was charged $35,000. Near the end of January 2014, I received a 6th dose of chemotherapy and was billed another $35,000. I was given a PET-CT nuclear scan that cost $5,000, and 1 week after that, on February 14, 2014, my wife and I were told by my oncologist that my advanced cancer was now in complete remission. As I am the sole caregiver for my wife, who has advanced multiple sclerosis, the news of the cancer's remission was a lifesaver for her as well as myself. Had it not been for the Patient Protection and Affordable Care Act, I would not have been able to purchase my health insurance for any price due to my pre-existing condition of having cancer. Had it not been for the income subsidy, I would have not been able to afford or pay the premium for a superior plan, a plan which saved my life. Thank you, President Obama, and thanks to every member of Congress that voted in favor of the life-saving Patient Protection and Affordable Care Act. Patricia Mills, Virginia Beach. My daughter, who has lupus, and her husband, who has juvenile diabetes, have been struggling for the last 6 years to keep their conditions under control. They have a gifted 17-year-old daughter who has been in the IB Academy in Virginia Beach and have had to sell their home to pay off debts due to complications from their illnesses. My husband and myself have made our home their home, but their struggles have continued because of the enormity of their medical expenses. Since they have been able to enter the Affordable Care Act for their insurance, they have been able to stabilize their lives financially. If the Affordable Care Act is repealed, I don't know what will happen to them. Insulin is extremely expensive, and so are the supplies to inject and check blood sugar to keep my son-in-law alive. There is no option for a diabetic to turn to get life-saving insulin a diabetic individual needs who works hard every day but falls above the Medicare threshold. We are living in terror at the thought of a repeal. Justine Jackson, Radford. As I type this, I'm currently sitting in the offices of the Community Health Center of the New River Valley. I'm 25 years old, and the last doctor I'd seen until today was my pediatrician. Like many struggling Americans, I cannot afford insurance and rely on low-income free clinics to receive preventive care. The AC helped programs like the one at the Community Health Center Clinic with funding. We cannot afford to lose clinics like this one with cuts funding public health. Americans should not be denied health care. We should not have to file for bankruptcy for becoming sick or avoiding a doctor altogether because it costs too much. The Affordable Care Act should be revised, not repealed. If Congress repeals the ACA, 20 million Americans risk losing insurance. That's 20 million Americans that may stop going to doctors because they can't afford it. I plead to Congress to care about your fellow Americans and give us health coverage that is affordable or, better yet, free. Seeing the doctor shouldn't revolve around a choice between going hungry or not. Gabrielle Falco, Alexandria, Virginia. Senator Kaine, my name is Gabriella. I'm a 26-year-old full-time student studying what she loves. I work part-time in my field of study to make some money to live on, but my school expenses are all covered by student loan. When I was 22, fresh out of college and unemployed, I was diagnosed with hyperparathyroidism and many severe kidney stones. To prevent kidney failure or worse, I required multiple surgeries, all of which were covered by my parents' insurance through the Affordable Care Act. Ever since, I've had twice-yearly checkups and ultrasounds, as well as some scares with my kidneys. There is no explanation for my medical history. All the doctors can do is monitor and treat it when troubles arrive. When I turned 26, I chose my own health care plan through the ACA. As I'm a student, I have no way of working full-time for benefits. The ACA has allowed me to live and safely and affordably monitor and treat my kidneys while finishing my master's degree. Were it not for the ACA, I fear my health would become a choice between death or bankruptcy. I don't know what I'll do if I lose my health care. I could not afford it without the ACA. I will fight for you, Senator Kaine, and please fight for me and my health in Washington. Corwin Hammond, Williamsburg, Virginia. Senator Kaine, before the ACA, my wife and I did not have, nor could we afford medical insurance. My wife is a business owner, and I'm a pastor of a small church in Toano, Virginia. I left my state job that provided full benefits because the ministry needs in my community were so great. I'm grateful for this legislation that allowed us to have peace of mind in knowing that we're covered and able to visit the doctor without going bankrupt. Why not just fix the components that need repairing instead of throwing millions of hardworking Americans to the wolves? We deserve better. How about the Congress and Senate repealing their health care and leaving ours alone? Thank you, Corwin Hammond. Sarah Mullins Spears, Prospect, Virginia. Senator Kaine, I have one perfectly imperfect child. He has not one but two pre-existing conditions. He was diagnosed with Asperger's syndrome, and he was also born with a unicameral bone cyst, a hollow bone that affects 1 in 4 children. This year, we were able to purchase our lifelong dream, a family farm, 18 perfect acres of peace and promise. This summer, we endured a medical ordeal we could never have imagined. My son broke his arm due to the cyst for the 4th time in less than 3 years. And we were finally approved for surgery to place a titanium rod through the cyst that would prevent further breaks. On July 26th, the surgery was successfully completed, and the next day we were released with instructions on pain management and to not remove the surgical bandages for 3 days. On July 30th, we removed the bandages to find a hot, swollen, bright red nightmare. We were readmitted to the hospital. I wasn't truly afraid until I saw the face of the same nurse that discharged us that night. She was fighting back tears. Over the next 3 days, there were 2 additional surgeries on my son, including a PICC line, and after 6 days, we were released to home health care. Suddenly, I had a health care provider. Every 8 hours, a dose of antibiotics had to be attached to the PICC line. It took approximately 90 minutes to administer, and then the line had to be cleaned and prepped. There was never a 6-hour window that I could be away from my child, which meant I was not able to work the 6-hour schedule at my part-time job, which means after the 2nd week, I was fired, told I could reapply when I was ready to come back to work. On August 26th, my son slept for almost 20 straight hours and then woke up vomiting and with a fever. So by lunch, we were readmitted to the hospital again. The next day while in the hospital, he broke out in a mystery rash from head to toe and had a white blood cell count of a chemo patient. For me, this was the worst because no one, not even the consult from UVA Infectious Diseases, knew why. After 3 days with the WBC count trending up and more research, the leap of faith was decided to end all antibiotics and see if they were the cause for the reactions. They were, and by October, my child was healed and eligible to school. Almost 5 weeks after he should have started his first day of middle school. By then, the bills had started to arrive daily. The first bill from the hospital was $105,000 before insurance and over $12,000 with benefits. We're still receiving bills, and our pre-insurance totals are well over $750,000 before insurance. But because of the ACA, we were capped at $7,500 out of our family pocket. That means $231 a month for 24 months, which helps our family, but it also means we can still afford our mortgage. I wake up every morning thankful for my healthy child and amazed that we live on this tiny piece of heaven. ACA made this possible for us. I have kept all bills, all x-rays, and documents related to our journey. Sasha Baskin, Richmond. When I was 17, I discovered that I had a rare and highly aggressive tumor in my jaw. It took 3 experimental surgeries to remove and replace the tumor with a metal implant and bone graft. I was fortunate enough to be dependent on my parents' insurance when this medical event took place. With the Affordable Care Act, I have been able to stay on my parents' insurance into college and graduate school and maintain my health status through regular doctor's visits. I require a yearly checkup to make sure that the medical implant is intact and that the bone graft is growing successfully. Within the next 5 to 10 years, I will need another surgery to replace the metal implant with my new technology. If the implant breaks or if I have any kind of accident that injures my jaw, I'll require emergency surgery and most likely have my jaw wired shut. I'll turn 26 in October and no longer be eligible to be on my family's insurance. But thanks to the Affordable Care Act, I can rely on being able to maintain affordable insurance and feel comfortable about my health. I can trust that I won't be turned away due to my pre-existing condition of a metal jaw and history of tumors. I can be sure that I will not reach a lifetime limit of coverage when I need another surgery, or if the worst happens and I need to have an emergency surgery. When the doctors first found this tumor when I was 17, they told me not to go to college because I needed so many surgeries. I was planning to attend school in Maryland. My parents lived in Connecticut, and my doctors were in Boston. But I was determined not to let my medical problem take control of my life. I went to and graduated from college in Maryland, and I'm now enrolled in graduate school, pursuing a Master's of Fine Arts in Richmond. I rely on the Affordable Care Act for safe and reliable access to doctors all over this country. I've been able to live my life independently because of the freedoms and access health care has provided. I'm a recent Virginia citizen, but I love it here. I am proud of my representation, and I hope my story will help you towards saving health care in our country. Ann Odenall, Richmond, Virginia. On New Year's Eve 2013, we were informed that our youngest son, Patrick, 18 years old, had type 1 diabetes, an incurable disease that comes with a lifetime of insulin dependence, injecting oneself 6 to 8 times a day. The cause is unknown. It is not a lifestyle disease, and there is no escaping it once diagnosed. The beta cells on our son's pancreas just stopped working. Type 1 diabetes is extremely dangerous, and when not managed...
Can we have order, please?
Senate will be in order.
Type 1 diabetes is extremely dangerous, and when it's not managed, causes blindness, kidney failure, limb loss, other issues, and even death. We were knocked off our feet, numb, confused, and overwhelmed by the danger and the medical requirements to stay within an acceptable insulin range. People with the disease must balance insulin doses with eating and other activities throughout the day and night. They must also measure their blood glucose level by pricking their fingers for blood 6 or more times a day. Our son still can have dangerous high or low blood glucose levels, both of which are life-threatening. He will die without insulin. He could die from too much insulin. In the midst of our fog and sadness, we remembered the ACA. At least the ACA will be there when Patrick is on his own. He will be able to get health insurance regardless of his prior condition, was our mantra. One day, Patrick came home and announced, "Great news, the ACA allows me to stay on your health insurance until I'm 26. I changed my retirement schedule. I can do that. I've watched and worried as insulin prices soar. Pat takes 2 types of insulin, a single carton of which costs between $400 and $500 retail. I run the math in my head, and I worry more about the lack of insurance. We're covered by my employer's insurance, which pays for most of the drugs, equipment, and healthcare needs. But what would happen if we found ourselves without insurance? What if I lost my job? Public service runs deep in our family. My husband's a retired teacher. Our oldest son is a policeman. It appears Pat may be moving toward nonprofit or public service work as well. Will he have health insurance? Will he have it without the ACA? I can promise anyone reading this that you know someone whose life will be positively impacted by the ACA. There are 20 million people like our son Patrick. Don't allow a repeal of the ACA. Fix the problems, work the issues, but don't play politics with our son's life. Linda Christ, Lynchburg, Virginia. I had employer health care for 38 years. In 2013, I lost my eyesight to macular degeneration and could no longer work. An insurance company covered me for $695 a month. With the lost income, I could no longer afford insurance. I contacted them and was told there was a new plan I could apply for. I applied and I was turned down, pre-existing condition. You see, in 1984, decades before I'd been diagnosed with kidney disease, I was treated and, according to my physician, cured, but the insurance company didn't care. I applied for insurance under the ACA and got a silver plan that cost me $345 a month. I was given a tax credit. The ACA saved me when I was waiting for Medicare to kick in after receiving disability. I'm sure that my premium would have gone up with the ACA, but it saved me when I needed it. John Carl Setzer, Winchester, Virginia. My son was born in 2009 with a severe congenital heart defect called hypoplastic left heart syndrome. Basically, he was born with half a heart and required 3 open heart surgeries. All of his treatment is considered palliative. In 2009, he had the first of 2 heart surgeries, in addition to another on his diaphragm. He was hospitalized for many weeks. He had insurance under my employer coverage. Clearly, he has a pre-existing condition. But the other issue is that he almost maxed out on his insurance coverage in his first year of life. My understanding is that the ACA eliminated the lifetime caps on insurance coverage, and my wife and I blew a major sigh of relief. Otherwise, he would have had to switch his coverage from my insurance to hers. However, he required another surgery a couple years later, and at some point will require a heart transplant. Thus, the insurance games would have continued. The ACA eliminated that burden on us, at least until he's an adult. The lifetime cap is not something I hear debated much these days, but it's something to consider for people that have major health complications. Please consider this in future legislation, in addition to coverage for pre-existing conditions. I'll read one more story and then cede to my colleague. I have so many more that I want to read, and this is just 1 or 2% of the 1,654 stories that my office has received in 3 weeks. Jennifer Smouse, Midlothian. In 2008, my husband started his own construction company after the national home building company he worked for pulled out of Richmond. It was our first time being self-employed, and along with adjusting to the idea of not receiving a paycheck on the 15th and 30th of each month, we needed to secure our own health care coverage for our family of 5. We submitted our applications for insurance and were notified a short time later that we would not be offered coverage for our oldest child. He's on the autism spectrum, and they were denying him coverage because of his autism diagnosis. We were shocked. Our son was high functioning and was not in need of any special medical services, and he still received this denial. With the passage of the ACA, we no longer had to worry about being denied coverage due to a medical diagnosis. This bill is not without its flaws. Our premiums were high in addition to the high deductible, and it was a stretch to afford the plans even with the credits available to us. But at least we felt on even ground. That, in addition to parenting a child on the autism spectrum, we didn't also have the challenge of not being able to secure health care coverage for him.